welcome to another Video3 Media Newsline. I'm Annalise Broughton. On today's programme, we'll be hearing from Jerry McLaughlin, Chief Executive of NHS Health Scotland, and Professor George Crooks, Medical Director for NHS 24. It's been a busy 2 months here at Video3 Media. Let's have a look at what we've been up to. We spent 3 days on location making a short film for East Renfrewshire Health and Social Care Partnership and their technology-enabled care services. The film is in the latter stages of post-production and will be released very soon. The Faculty of Public Health had their annual conference at the Dunblane Hydro in November. Minister for Public Health and Sport, Aileen Campbell, was in attendance, and the content produced throughout the 2 days is available from Video3 Media. Drop us an email or visit our website for more details. And finally, the Scottish Ambulance Service has a new trauma package and had us along to film a demonstration. Get in touch to have a look for yourself. NHS Health Scotland is the National Health Board, working to reduce health inequalities and improve health. I went to speak to Chief Executive Jerry McLaughlin to find out more.
We describe our vision as being to have a Scotland where all of us have equal access to good health and to the opportunities that create good health, no matter where we come from. And essentially, this is a strategy that's about trying to reduce what I think is the biggest health challenge Scotland faces, and that's the health inequalities that we experience, the enormous difference in health and life outcomes depending on who we are and where we live in Scotland. What we have is a situation that even in this city, the city in which I live, if we travelled across from the southeast to the northwest of the city, we would see an enormous difference in both the length of time we are likely to live our lives and in the amount of our life that we live in good health. So that really is determined by quite a number of really quite complex factors, but ones that frankly are quite intuitive. So where we are born, our experience of our early life, our parents living in our families, the schools that we go to, the kind of job opportunities that we have, the income that we have, the houses we live in, these all are in evidence closely tied with the kind of health outcomes we have. And so reducing health inequalities isn't just a job for our National Health Service. It's a job for all of our public services, and a job that really needs, I think, very strong civic leadership, strong political leadership, and strong public services leadership. A better Scotland would look like a Scotland in which no matter where we grow up, no matter what our life circumstances, we have a much more even likelihood of living the same kind of long life and the same kind of long, healthier life. So this is measuring things very much from a health perspective, but it extends to many other areas of our life. An example of that might be that the Scottish Government currently, the First Minister said in her new programme for government that her biggest policy priority was reducing the educational attainment gap in Scotland. So our average educational attainment in Scotland in the last 20 years has improved. It's improved really quite substantially, just as our average health in Scotland has improved very much. But there are a lot of Scots, a lot of people living in Scotland that just have not had that benefit. And in some ways, at times we've seen their outcomes drag way behind what that average looks like. So coming back to my example about educational attainment, if we look at what contributes towards improving educational attainment for all kids going to school in Scotland, all kids growing up in Scotland, we'll actually do some of the things that will also improve health and well-being for those children. That's why I said that there's no simple solutions to this. This requires us to think, I think, in a quite different way, right across our public services arena, right across the landscape, to think about the contribution that in the provision of housing that we have, in the way in which we drive education and support youngsters, particularly from poorer backgrounds, do much better in schools, so that they get onto that job ladder, they get onto that housing ladder, and they then enjoy the same kinds of health outcomes that I enjoy and that my children and my grandchildren enjoy. For many years we promoted health improvement messages, and we know that that has an impact. It has a positive impact, and that's contributed towards improving Scotland's average health. But we also know, particularly from the social attitude surveys, that quite often people know that the damage that drinking too much or eating too much or not being physically active enough can do to them, but they don't act upon that. So that again shows that this is not a straightforward provision of information and then people change their behaviour. And right across the world, there's a recognition that what determines our health goes way beyond simply the way in which we live our own lives and our own health behaviours. So if I maybe can give you a couple of examples. So we've now had for many decades some very strong health improvement messages around about tobacco and about reducing smoking. But perhaps the single biggest contribution in the last 20 years towards reducing smoking in Scotland was the use of legislation to prevent people smoking in public places. Now, the importance of that was recognising the damage people smoking was doing to others' health. That's why in bars and restaurants this was a really important issue for the health of other customers and for the health of the staff that were there. Introducing that measure has had an enormous impact in reducing the amount of smoking across Scotland. That's one of the things that's improving Scotland's health. It's improving it. Less people are having heart attacks and strokes simply as a result of that measure. But there were also some consequences of that we didn't even understand. So the numbers of kids who are taken to accident and emergency departments as a result of their asthma, which had been growing for up to almost 10% per year, all of a sudden plateaued and then fell off. And we know that that's because they're now reduced to much less second-hand smoke. Another example of this would be some of the work that we've done around alcohol. Again, we know about the health advice about reducing our alcohol intake. I can say that with some confidence because as that happens, I'm on a bit of a kick just now, so perhaps I wouldn't have been able to say this to you a couple of months ago. But one of the things that's really important, you'll be aware of the measures that the government has tried to take in the last couple of years around introducing a minimum unit price for alcohol. And that's based on very strong advice, very strong evidence that particularly those who are drinking the most harmful alcohol, the very high strength, very cheap alcohol, do so partly because it's incredibly cheaply available. Sometimes, you've seen from the adverts, sometimes as cheap as water is to buy in the supermarket. So the measure to introduce minimum unit pricing, which has been held up as a result of a legal dispute, but hopefully we might be seeing the light at the end of the tunnel, is a direct example of how we then encourage people's behaviour to be different. We introduce a very strong trigger because, again, from the evidence, we know that the cost of a unit of alcohol is directly related to the amount that's consumed. So some of that very cheap cider, for example, that's drunk to excess by far too many people with harmful drinking habits, that will be tackled much more effectively by introducing a minimum unit price on alcohol than by continuing to deliver simple health improvement messages. So these are a couple of examples of how we might use the work that Health Scotland brings about the research and the evidence that our analysts look at, and then to use that to introduce different policy approaches which will both complement the health improvement messages but actually get to much more the root of the problem. We live in a country which I think is far too unequal in terms of not only our population health, but many other life outcomes, and I include employment in that, I include income in that, I include housing in that. Just in very many aspects we have, I think, quite an unequal society. Indeed, this has become really at the centre of much of our political discussion, much of our public policy discussion in the last few years, and I'm delighted about that. And the reason I'm delighted about that is not only do I want the population of Scotland to be much healthier, but I want that distribution of health and distribution of those other life outcomes to be much fairer. It can't be a good thing for us as a country to have such talent and opportunity squandered and wasted and not contributing towards Scotland's well-being as a country. We know both economically and socially that unequal countries are not as productive and they're not as good places for people to live and grow up in. And that's why Health Scotland's strategy is called A Fairer, Healthier Scotland.
Digital health and care technologies can have a big impact on our lives in positive ways. Sometimes these can be small ways, but also big, complex ways. Gabriella went along to NHS 24 to speak to Professor George Crooks.
Good morning, George. So can you tell us how digital care and health technologies has a positive impact on our lives?
I think technology it's having a positive impact in our lives at this moment in time. But in health and care, we have lagged behind how people use technology in their day-to-day lives. What it can really do are two things. Number one, it can give people back control, particularly control over their health, and it can also reduce anxiety and concerns. What I mean by that is that for control, it can allow people to manage their own long-term condition easily, safely and effectively, knowing that they're doing the right thing by providing information, advice and support that's readily accessible. And also, if you're looking after someone else, it can take that worry away that they're safe and okay if you're out going shopping or doing something else. So these are not difficult to do. What is really important is that people are aware of what is available in the digital scene for them.
Can you tell us something about how technologies can be used to support more integrated and responsive services?
It can do that through intelligent redesign, and I think people have to realise that technology is a word that often people associate with complexity and it's difficult and I have to be a genius to use it. But the reality is that it's incredibly simple, and it's usually the simplest things that make the greatest difference. Being reminded when to take your tablets. Technology can do that incredibly simply. Reminding you when you've got an appointment to go to see the hospital or to see the doctor. To be able to access information about your condition that your doctor told you yesterday or last week and you can't quite remember what he said. That often causes people anxiety and concern, but that is available through technology. But it can be a little bit more complicated. You can check your own blood pressure, you can check your weight. Round about the house, sensors can check that an elderly relative is moving, or even they're sleeping soundly in their bed. So a whole host of different solutions are available, but what is really fundamental to this is that we can now tailor-make those solutions to you as an individual person or you as a family in the special circumstances that you're wrestling with day in, day out. And that is where the major difference is going to be as we move forward into the future.
What can you tell us about the Digital Health and Care Conference taking place on the 30th of November in Edinburgh?
The conference is a way for us across the whole health and care family and involving the third sector and service users coming together to talk about what we've done and what the future looks like. And this year we're celebrating innovation. We're going to share examples of best practice. The Cabinet Secretary from Health and Wellbeing is going to be there and is going to set out the government's aspirations for the digital health and care landscape going forward. But the thing about Scotland is we're not afraid to learn from elsewhere. So we've got some speakers coming from other parts of Europe, let alone other parts of the United Kingdom, to share their experiences with us. But it's also a get-together. It's not only what happens in the big room when people are presenting, but it's what happens in the breakout sessions and over a coffee or over lunch. It's the ability to network and share experiences, to learn that someone is doing something that you're considering doing and making those connections, because that's what moves this whole thing forward. And Scotland is one of the leading regions in Europe, if not globally, in this agenda. That doesn't happen by accident. It's events like the conference and the whole week that wraps around the conference that allows us to continue to move this agenda forward, because we can only do that by working in partnership.
So what's the idea behind Digital Health and Care Week?
Digital Health and Care Week is a way of celebrating what we're doing in digital health and care, but not simply in a very select and posh venue with a restricted audience. This is allowing events to happen across the whole of Scotland, because after all, digital health and care technologies are deployed in communities, in remote and rural areas as well as the cities across Scotland. So we're encouraging everyone involved in this agenda to set up their own events. They don't have to be large, they can be very small, they can be very focused within a small community, but we're really encouraging people to raise the profile of digital health and care, because we all know that the way we deliver our services at the moment are not sustainable into the long term. We know that people want to have more control over their lives, and these technologies can give that. But again, that doesn't happen by accident. You have to know about it. You have to know who else is working in that environment. You need to know where to get help and what's available. And the events that we're planning across the whole of this week are designed to do that and other things.
Thanks very much, George.
Well, that's all we've got time for this month. Thanks for watching, and we'll see you next month.